Part 2 of our 3-part series on chronic headaches. Let's dive into it. Roll that intro. What's up everyone, Dr. Eric Jackson here. Hope you're all doing well. So like I mentioned in the intro, it's part 2 of our 3-part series on headaches and how dentists can help you relieve your headache issues. In part 1, you'll remember that we spoke on kind of the background of headaches. Specifically, we touched on the 2 primary classifications, primary and secondary. And of that, we're going to really focus on the secondary. Secondary being those headaches that are present because of another condition. The classic example is a sinus headache, right, caused by sinusitis. So we went through a litany of different potential causes of secondary headaches that might be medical in nature, which is why ultimately, as the final recap of part 1, we always recommend you bring in and you start with your primary care physician. When you have chronic headaches, it can be a lot of things that are not dental. So it's very important to loop in and start with your medical provider in addition to talking to your dentist and other providers as well. All right, so let's talk about the first possible cause, dental cause of chronic headaches. This one's pretty straightforward. I'm going to call it dental maladies, right? Kind of an umbrella term for a lot of dental issues. Toothaches, cavities, broken teeth, infections. Each of these are capable of yielding a secondary headache, secondary chronic type headache. What do we do about it? Well, basically, you go to the dentist and you fix the stimuli, right? If you have a broken tooth that's causing the headache, you go to the dentist and you have that addressed. One of many number of ways. Same with the infection. Same with the cavity. Once the dental issue is addressed, typically the headaches will reduce and or resolve completely because that was the causation and the causation is now removed. The second possible dental causation isn't as quite as straightforward as dental maladies, right? Dental malocclusion is a fancy word for saying, describing how your teeth just don't line up right? A malocclusion is a bad bite. And why might that cause chronic headaches? Well, when you have a dental malocclusion, it can interfere with the normal patterns of movements of the body's jaw muscles. They don't move in the normal way. And so if the teeth aren't in the right condition, right locations rather, that causes some issues. The body will sometimes try to correct these issues on its own. That's not a bad thing. Ultimately, this can be actually kind of a slow and painless process over time. This works for low-grade, mild type malocclusions, and therefore usually associated with low-grade, mild secondary headaches. An example of this would be when you have excessive wear on one tooth that is kind of out of line. Say you've got a tooth that's sticking out a little bit further, your body will wear that tooth down more because it's doing more than its fair share of the load. It's also shaving that tooth down a little bit to even things out because your body likes equilibrium. The left and the right, the front and the back, the mouth wants to be even, level, equilibrated. And the neat part about it is that with enough time, your body will actually do that for you. Another example of this is a chronically slightly mobile tooth, right? The tooth isn't quite falling out, but it's not quite stable. The body just basically needs it to be a little more forgiving. And so the body will just kind of keep it in a partially healthy, partially unhealthy situation there to accommodate for the malocclusion. It's kind of, think of it as a shock absorber. It allows for a little bit more travel. Is this a bad thing? Well, it's not the greatest thing, but it is a natural part of the human dentition. And think back thousands of years, this is a very developmental type feature of the human anatomy. Now, sometimes we don't get long periods of wearing down and gentle wearing. We get short, acute bursts of correction, right? In a recent video, I'll link to it above and below, I did a 3-part series on the specific increased ailments we've seen due to stress due to COVID-19, and one of which was a severe increase in tooth fractures. In one case that I shared in that video, and I'll share here now, a patient came in with a significant portion of his front bottom tooth sheared off, probably about 40%, 50%, if you kind of go by volume. Now, how does that relate to today's discussion on headaches? Well, you'll notice the malocclusion of that tooth that broke. It's out further. It's rotated and it's sticking out. That is the very definition of a malocclusion. And he did, of course, hit that one spot quite heavily when he was eating his morning breakfast bar. Now, over time, my theory on that is it's a cyclic fatigue type phenomenon. He was banging into that, wearing it down over and over and over again, causing minor bending and fracture and whatnot. We go into that in the prior video. So if you want to watch that to a little bit more in depth, go right ahead. But cyclic fatigue is a very real thing that eventually then causes a acute fracture or acute failure of the substance. In this case, the tooth. The tooth broke because it was out of line. It wasn't one of the teeth that was in line. It was the out of line tooth that was doing way too much of its extra work. So the third cause that we're going to discuss here today also deals with musculature of the head and neck. It's grinding, clenching, and TMJ problems, right? So much like malocclusion, grinding, clenching, and TMJ problems put extra stress on your muscles, your jaw, your head, your neck, and that all relates towards secondary causation of chronic headaches. These three causes are very common, very significant, especially if you're suffering from them, but also very treatable. In part 3, we're going to go ahead and talk about how we're going to treat these properly, different options that you might consider speaking with your dental provider about. So thanks for watching part 2. Always appreciate your viewership. If you like the video, hit like, consider subscribing to the channel, and of course, put all your comments and questions below. I'll see you in part 3 where we talk about treatment options to address these three causations. Take care. Talk to you then. Bye-bye now.